We're interrupting our regular news bulletin today to focus on one specific story that demands the attention of the country right now, and that is what is playing out in Uttar Pradesh. In Uttar Pradesh, as of the 13th of September, as of yesterday, according to the Times of India, 12,000 people are bedridden in Firozabad with a viral fever that has already killed 114 people, 88 of whom were children. 88 children are dead in one district because of a viral fever. This comes after authorities are conducting door-to-door surveys right now to figure out what is really wrong and what is causing this fever. Now, as the establishment has also said that this is a very dangerous strain of dengue. The Times of India reports that on Sunday, government hospitals were completely full. There were more than one patient in every bed, and they were running dangerously low as well on platelets that are needed for transfusion in treatment of dengue. The Times of India also carried the story of a parent whose 5-year-old child, a boy, died for lack of treatment because private hospitals were asking for 30,000 rupees in advance before treatment could begin. This is the whole story of what is playing out right now in Uttar Pradesh. Reports actually began coming in around the 5th of September on the national media that there was a mysterious fever in Uttar Pradesh killing people, but mostly children. According to government data, as on the 5th of September, 51 people had died, 40 of whom were children, and they were complaining of fevers. But India Today at that point said the actual numbers could be as high as 80 people who had died by the 5th of September. Blood samples were being collected and sent for testing. Cases were reported mainly from Firozabad, Agra, Mainpuri and Kasganj in Uttar Pradesh. It started really on the 18th of August, according to India Today, when 4 children were admitted to hospital complaining of a fever. They were treated for viral fever initially, but it escalated from there. And between the 18th of August and the 24th of August, the viral fever became uncontrollable. The number of deaths were mounting. Hospitals were swelling with patients. People were bringing in their very small children who were very, very sick. There was a shortage of beds at the district hospital. Reports were suggesting that there were at least 3 patients in each bed. And they, like I said, they were running out of platelets needed for dengue treatment. Dr. Hansraj of CMS Medical College, quoted by India Today, said 90 children had been admitted, and the hospital was now preparing extra wards for these children. And this is a report that was dated the 23rd of August. Due to the lack of hospitals, patients and relatives were now taking these children away from Firozabad to Agra, to Aligarh, to Hathras, to Mathura in order to find room in hospitals. On the 30th of August, this is beginning the 18th of August, by the 30th of August, the Chief Minister, Mr. Yogi Adityanath, visited the medical college in Firozabad. He told the media that 39 people had lost their lives due to a viral fever, out of which 32 were children, and he expressed displeasure with the district health administration. Now, cutting back to where we are today, as of the 12th of September, now the problem is swelling past that district. Long queues of patients are being reported in hospitals in Baila district. Number of patients suffering from viral fever in the district is increasing by 15 to 20% every day. Family members who are taking their children to hospital are having to wait for many, many hours in order to be able to just see a doctor because the hospitals are completely overwhelmed. There was a terrible story that popped up that was covered by NDTV. This is on the 6th of September, of a woman who fell at the feet of a doctor begging that her 12-year-old be saved from the dengue fever that he was currently battling. The doctor reassured the mother and directed the hospital staff to take the children inside. The state government said that most of the deaths were due to what they called a dengue hemorrhagic fever, a severe form of the dengue disease. According to NDTV, Dr. Aneja said, and I quote, that 540 children were admitted in that hospital, but everybody wants to get admitted. They're okay with 2 people in one bed. The focus is on saving lives. At this moment, the idea is to get the child admitted. Now, this was the 6th of September when there were 500 children admitted because of that fever. In the meantime, though, Scroll carried an article on the 8th of September that said Uttar Pradesh had reported 1,669 dengue cases, but not a single death. Now, at that point, there were reports coming in Firozabad that 50 people had already died, but Uttar Pradesh government had not listed it as dengue deaths. The Principal Secretary of Health in Uttar Pradesh, Mr. Amit Mohan Prasad, had said, and I quote, this is according to Scroll, until a death audit is carried out, none of these deaths can be confirmed as being due to dengue. Dr. Vikas Singhal, Joint Director of the state's Vector-Borne Disease Unit, explained that most deaths have occurred outside of the hospital. For those who have died before hospitalization, the districts will have to take detailed medical history before they can be labeled as dengue deaths, end quote. For now, at that point, as of the 8th of September, it was being considered viral fevers. Now, here's where the problem goes past the borders of Uttar Pradesh. Madhya Pradesh's Bhopal is now also complaining about a shortage of platelets for the treatment of dengue. There is a cause for concern as blood donations are already at a low because of COVID. Experts are warning that vector-borne outbreak compared to 2018 and 19, where Bhopal alone had reported 1,000 cases of dengue. According to the Times of India, 330 vector-borne ailment-related patients were diagnosed in Jabalpur, 250 in Ratlam, 200 in Malwa, and 150 in Chhindwara. This is in Madhya Pradesh. Also, bordering Uttar Pradesh, Haryana. According to the Hindustan Times, in a report today, Haryana's Palwal district, several children have contracted very high fever. According to some reports, about 4 of them have already died. This is according to ANI, which has said the state government has rushed teams of the health department to that area. Dr. Vijay Kumar, who is the senior medical officer in Hatin, has said, and I quote, "We got news of some cases of fever and 1 or 2 deaths. Taking notice, our health teams have come here. We are doing surveys. Medicines are being provided. Spraying is being done. Testing for COVID-19, dengue and malaria has already started. We're testing a few other cases. 4 or 5 children have died due to dengue and several children are ill," Kumar added. There has been a report also in News Laundry that suggests that the reason for the dengue fever outbreak really in Firozabad is basically bad hygiene, the fact that there is garbage in the streets, there's a lot of water collected in the streets, and it's that lack of hygiene really that is causing children to die. In the meantime, the Prime Minister, Mr. Narendra Modi, was in Uttar Pradesh today, and he praised the Uttar Pradesh Chief Minister Yogi Adityanath, saying that Uttar Pradesh has become a shining example of double-engine government, double benefits. Now, while launching the Raja Mahendra Pratap Singh State University at Aligarh, the Prime Minister said, and I quote, "It gives me tremendous satisfaction that UP, once seen as a hindrance to the country's development, is today leading the biggest development campaigns in the country. Uttar Pradesh is increasingly emerging as a favorable destination for national and international investors. This happens when a conducive environment is nurtured and necessary resources are provided. Today, Uttar Pradesh has become a shining example of double benefits of double-engine government." I believe he's referring to the fact that both the state and the centre are being run by the same party at this time. There was also a time, he said, and I quote, "when goons ruled the state, but now all extortionist mafia leaders are behind bars. People in Uttar Pradesh can forget the scams that the state had seen in the past and how corrupt people were chosen for key roles. Today, Yogi Ji's government is invested in the state's development," he added. Now, this is obviously in light with the fact that there is an election coming up in Uttar Pradesh in early next calendar year. There was no statement made about the children that are currently dying and what needs to be done really on the ground to stop the deaths. But like I said in the beginning of this story, 12 people are bedridden and 88 children have died in Uttar Pradesh of dengue as of now. This is a developing story. There is also concern building, like I said, in Madhya Pradesh and in Haryana that it might have spread. And this is something to keep a very close eye on. Remember, the unfortunate part about it is that the symptoms of malaria, dengue and COVID tend to be very similar. So testing is of paramount importance and at the earliest. These hospitals are running out of space right now, and also running out of platelets for blood transfusion. That's the whole story that we have at this point. We will bring you more updates as and when we have them. Thank you for listening.